Thank you very much for inviting me today. When I planned this, I figured that by now, a little afternoon, we'll already be talking about the digital divide. And I decided to focus on very specific details of how it worked in a community academic partnership to reduce health disparities. So these are my community partners. It's a community group that was called at the time La Comunidad Habla, which is Spanish for the community speaks. And like I said, my goal for today is to talk about specifics. Not close enough, thanks. To talk about specifics of how I worked with the idea that you think of specific that you can work with in your community. So anybody been to New Mexico? Wow, that's really nice. The first thing I learned from my mentor about writing grants is that I need to mention that New Mexico is within the United States. So it is.
Oh, no.
But it's also very special in many ways. We are a minority-majority state with the largest ethnic group being Latinos or Hispanics, which comprise 47% of the population. The third largest group is what we call Anglo, non-Hispanic whites, and the third are Native Americans. We enjoy a lot of cultural, historical, and natural richness, as all of you have been there noticed, but at the same time, we also have one of the highest poverty rates in the nation, which leads, as we all know, to a lot of health disparities. One of the things that I learned 2 weeks ago is that we actually have the lowest rate of broadband access at home. I didn't know that doing all this research all these years. The context within Albuquerque, in which we predominantly, not exclusively, but predominantly worked in, was the Southeast Albuquerque, which is very close actually to the University of New Mexico. It is now called the International District in recognition of its ethnic diversity. It is the most ethnic diverse area in the state. And it's Portal, it's a gateway for a lot of immigrants and refugees, partially because of its central location and relative decent public transportation, and also because it has relatively affordable housing. One of the challenges the community is dealing with is a very high rate of rental property. It's definitely not the only low-income, predominantly Latino minority community in Albuquerque, but it is definitely unique in high rates of rental, which makes building social capital really difficult because people don't own their homes and they really move in and out of that area. So I will talk a little bit about the digital divide within this context. As we've seen today, the digital divide still persists despite the use of mobile technology, et cetera. And when we talk about Latinos, despite, again, high rates of using mobile technology, they're still underrepresented in web contact and access to the web, in their representation in the information technology workforce. And also there's lack of cultural, including linguistic diversity of content on the internet, particularly when we talk about health. And the ramification of this is being marginalized both socially and economically. In terms of health, in order to make informed decision making, we need access to credible information. And we know from the general population that people that look and access health information online report much better health outcomes. So who are we leaving out when we don't think about that? In order to bridge the digital divide, the model that I'm presenting today is focused on the idea that it's not enough to just provide physical access. It's necessary, but it's not sufficient. And we also need to have culturally appropriate interventions that meet the information needs of communities. So with the idea that communities need support and culturally appropriate, and as a lot of you mentioned, appropriate literacy level, regardless of the language. So in other words, it's not enough to just have information in Spanish, for example. It also needs to be an appropriate literacy level. So going back to the community partners, they were a community digital media group, so they're applying concepts from media into the internet. They were created in 2002 as part of an outreach for University of New Mexico pediatric clinic that resides in the community and serves only this community. And the idea was to provide women in particular with technological and health advocacy leadership in the community. They had a very humble beginning as evening classes in computer in order to make them accessible to women in particular. They were for women only to gain support of male partners. And they provided childcare, which is a crucial component. I cannot emphasize it enough. One of their major projects was to create a bilingual online healthcare resource directory, and I was very excited to check it before my flight, and it's still online, so you can look it up, what they have done. I'm not sure how they do it, but apparently they managed to get consistent funding to maintain the website, which was a challenge. And the other project that they did basically was to provide opportunities for community members to access health information and technology. And with very little resources financially, really, they were able to reach over 1,000 community members and providers over the course of about 2 or 3 years only. The model, which may or may not work for other community groups, and they actually changed it a little bit later, but at the time they relied almost exclusively on their own work, both in terms of technology and content. And they provided, as you can see in this picture, they provided small groups teaching and support. Part of it was simply that they worked in places where there were not many computers, so it limited itself. And they collaborated with other community organizations in order to make it happen. So this is an example of one of the historieta, illustrated stories that they used that was around advocacy within the healthcare system. So when I came into the picture, I was very interested in how people are using the internet for health information seeking. It was fairly new at the time. There wasn't a lot of research. It changed a lot. And I was interested in extending this research to diverse community. So my first question to them was, what do people look for? What type of health information do they search when they're finally in front of computer, oftentimes for pretty much the first time in their life? What do they look for? And the answer was behavioral health. They were seeking information about behavioral health, particularly of children. And the reason was that a lot of children in general have, or let's put it this way, a lot of parents have questions about development and behavior of children in all communities, and there's still a lot of stigma attached to it and not enough services to access. So that was really appropriate to look for online. It's a topic that actually happens to be very dear to my heart, and I was very happy to work with them on that. So I did a review of the literature. I'm sure some of you are familiar with this, but statistics in general, the situation in general in the US is very grim, where most children who need evaluation and treatment do not receive it. And certainly children do not receive it on time. We're not doing well compared to other developed countries in this area at all. But within this situation, Latino children, particularly pre-school age, are in particular unmet need. So what happens is children get diagnosed only once they're in school. So about first, second graders when they finally get a diagnosis if they have a problem, and hopefully treatment. So we're missing all crucial years of early intervention in this country. And the other thing that is unique about help seeking for children is, especially at these ages, they don't look for help on their own. It's the parents typically or a caretaker that have to do it for them. And when you read the previous research, you realize that the less stigma that parents have about accessing healthcare, mental health care for their children, and the more knowledge that they have about early childhood development and behavior and its importance, the more likely they are to access services. So as a communication scholar, there is a lot of room to work around intervention that would affect knowledge and reduce stigma, but at least at the time that I did that literature review, there were no such efforts. So the next step was to create collaboration with mental health experts. These were providers that also worked at the University of New Mexico. It was a child psychiatrist and child psychologist. And at the time, I was part of the School of Medicine. I had a research position there, which allowed me access to pilot funding. I got one local funding and two CTSC, we call them, other may know it as CTSA funding, which was really crucial because they really acknowledged the importance of community work and allowed me to compensate my community partners. So they were able to really be co-investigators. So just in brief, we had two larger aims on this work. One was to look into community members' information needs, so what information they want to know about development and early childhood behavior, and then we wanted to start developing educational outreach. So we did focus group. We had certain focus group in Spanish and a few in English. And we realized during this focus group that we really have to provide information right there, right now, because it wouldn't have been ethical not to do so, given what we learned. So our collaborators, who were experts, just had a presentation in the community that got a really good turnout. And the next step is we created educational material, including education, entertainment, illustrated story that our partners created based on what we learned in the focus groups. So we have quite a few research goals for the future. The main one is to create a larger intervention that we will be able to systematically examine certain aspects of it, including, for me, it's really interesting to look into differences and maybe similarities between digital and print media, because the community organization we're using both of them. I am working now actually on creating further collaborations around early childhood mental health, which, by the way, became a really happening topic in New Mexico a few years after we did this work. So it's really nice to have that support. And the other thing that we realized is that daycare in this community can be a great place to have intervention. They're very interested in that because of their own needs for accreditation. And it is a really great place to talk to both daycare providers and to parents. Part of the disparities in early childhood are related to the fact that the teachers at daycares are not familiar themselves at all with early childhood development and behavior. One thing that we learn is that when a child has a problem and they cannot deal with it, the child is just removed from that daycare, and that's the best they can do at this point. So a little bit about challenges. I know all of us have the challenge of continuous funding, but arguably when you work on technology, that can be even more pronounced. Like I said, maintaining a website, for example, is really hard to find funding to, and they have to be very creative models to continue to do it. So I would say about things that were said earlier, I agree with evidence-based as crucial, but also funding mechanism to include this technology in order to address disparities is very important. What I faced was that local heroes move on. They may find a more stable job at the local buffet, or they may had a partner that didn't want them to work on the project, or they may open their own consultancy, but they move on and their models of working change. So the collaboration has to adjust to that, different than if you work with a collaborator from a university, let's say. Another issue that I talked about in my article, I'll provide the references in a little bit, is that the community leaders still to this day continue to have various barriers, including barriers to having consistent broadband access at home. And the other tension is between the different requirements of community organizations and academia. On one hand, for community, a lot of what we do in academia is really not part of their practice. It's a little bit hard to sometimes explain what you do and to get it valued. And the other way around is that it's sometimes hard to explain at universities, and I'm really fortunate that I work in an institution that does appreciate community-based participatory research and the time it takes, but it is still very different and takes much longer than if you, for example, have your undergrad student answer a survey of 5 questions. So there are tensions there. So in summary, this was my model for this partnership. First, we identify content area with the community, or really the community identified the content area. Then review of the literature supported that and suggested future directions and informed what we were doing. We co-created, therefore, their research questions based on these 2 types of knowledge. And we build on community models. So they were working in certain areas in the community. We went with that. They had certain locations they worked from. We worked with these locations, et cetera. So we really adapted to their models and learned from them a lot. It was crucial to create multidisciplinary collaboration with other providers, which also would make it more sustainable in the future. And then how many have done that? You identify funding source, you write grant, do you get it? You don't get it, so you write another grant. You really have to be persistent. It's a very important loop within this model. And you really have to hope that your community partners can wait, because they also are familiar with the process of writing grants, but their grants typically have much shorter deadlines. Turnaround is much faster. So things happen that, like I said, may not happen in a different type of partnership. So that was really fast. I want to thank our team. As you can see, some of them are the mental health professionals that we worked with and community members, and some of them were team members on the part of University of New Mexico. And if you want more information, I have 3 publications that describe these processes in greater length. Thank you.